Well, South Africa's healthcare system is under immense pressure as a second wave of coronavirus infections sweeps across the country. There is a lack of resources available in some provinces. Authorities are urging people to protect themselves during the festive season. We're all over the story. Nobesuthu Hejana is in Cape Town. Manqoba and Mchunu is in Johannesburg. So, of course, Nobesuthu, we'll start with you. The health department saying it's concerned about the increasing numbers of COVID-19 infections, and as a result, it's putting pressure on healthcare workers. How are those healthcare workers coping in Cape Town? All right, we're having issues with Nobesuthu's audio. We'll go back to her in a moment. But Manqoba, let's pick up on the same discussion with you regarding healthcare workers fearing the worst in Gauteng.
Certainly, Shahan, many of them saying that they are demotivated, frustrated and feel dejected. That's how they've put it in terms of how they're dealing with this new wave of infections here in Gauteng. We did speak to some of the healthcare workers, some of whom spoke to us privately on condition of anonymity, saying that, of course, they fear for their lives, Shahan, given the fact that they don't believe that the Gauteng Health Department is ready to deal with the new wave of infection. And, of course, the all-standing issues, Shahan, the issues of staff shortages and issues of overcrowding are some of the concerns that were raised by some of these healthcare workers. But let me bring in somebody who knows much better on this particular subject. I'm now joined by Zola Sapeta, who is the General Secretary of NEHAWU in the national scheme. Zola, thank you for your time. Let's start here. Many of the nurses we spoke to earlier on saying that they fear for their lives. Is this the same sense that you're getting from your own employees or your own union members?
Yes, across the country, there's a general fear, precisely because, particularly after the study that had exposed the quality of KN95, which is not equal to the standard, and also having had the new variant as announced by the minister 3 days ago. So that worries them, given their experiences of what have been handled and subjected to the conditions that are not protecting them from the first wave. So now things are really tough, and we see numbers growing. We see both in terms of the new infection and also in terms of deaths. So, of course, they will be worried because there are no material changes from the behavior and the conduct that government did in the first wave. So, just a general anxiety on the second wave.
What's your sense here in Gauteng? Do you get a sense that the Gauteng government is ready this time around to deal with some of these issues concerning the second wave?
Of course, Gauteng will not be immune or different from the department as a whole. The national department, in our view, is not ready because there are no material improvement from the first wave up to the second wave, except to be told that we must not panic. Unfortunately, we ought to panic because we see people dying in our hands. We are not protected. And that's a reality. Gauteng is not immune. It's like any other province. Of course, the degree differs from Eastern Cape and so forth, but Gauteng also is part of the national establishment in terms of health system in this country.
But of course, the two major concerning provinces are the Eastern Cape, the Western Cape, and also you can add KwaZulu-Natal on that. In terms of what your members are telling you, how serious is the situation? How dire is the situation there?
It is. For instance, we will have to go to Western Cape sometime this week to interface our members, KZN, and also Eastern Cape. There's a general panic. We can't sleep. We receive voice notes, people crying, being scared, and so forth. So that's a general problem that really we will have to attend to it.
Thank you. That was Zola Sapeta, who is the General Secretary of NEHAWU, saying that, of course, they are concerned as a union from some of those complaints that they are receiving from the members, which are not quite good, Shahan, given the fact that South Africa is now battling a new strain of COVID-19.
Yes, and let's try this again with Nobesuthu and stick to that theme regarding healthcare workers and the pressure they're under in Cape Town.
All right, so Shahan, unions representing nurses and healthcare practitioners, they do say that the nurses are not coping. They are exhausted, tired and scared in the second wave. They're saying that they don't have enough support because they are exposed, risking their lives and the public is not adhering to the regulations, which is making their work a bit difficult. And now that we are on the second wave, hospitals diverting patients because of the capacity, they're saying that they are not coping at this particular time. But I did speak to a representative of POSA, and her name is, she did mention that they do have concerns for their workers. Let's take a listen to what she had to say.
It's our behavior at the end of the day that leads to the pressures which is on them, you know. And especially with our private hospitals that's being said now, they are full to the max, put more pressure on our public space. And the fact that there's not even enough manpower to look after all your patients. And I mean, there's also other critical services that needs the nurse. And, you know, and I salute the nurses, we salute them, and we had so many fallen heroes. Up until this morning, we had more nurses who passed away. I mean, it's just before the festive season. How festive is their season going to be?
So, Nobesuthu, given the pressure we're seeing and the numbers, are they considering reopening field hospitals in the Western Cape?
Well, at this particular time, Dr. Karim did say that they're not looking into that, but they will intensify resources that they were using in the first wave, and they will be ensuring that people do get assistance when they go to hospital. The diverts don't mean that people will not be assisted, but they will be looking at how the particular hospital can deal with a certain capacity, and people will be moved to other hospitals around the Cape Metro. But they did say that about 231 ICU care beds in the hospitals are fluctuating between 80 to 100%, meaning that most of Cape Metro hospitals, as well as those in the rural areas, are full at this particular time.
All right, we're going to leave it right there. Nobesuthu Hejana is in Cape Town, Manqoba, Mchunu in Johannesburg.